Hi, welcome to Beyond the Paper Gown. I'm your host, Dr. Mitzi Krockover. Today, we're joined by Ifeoluwa Dare-Johnson, a health technology entrepreneur and women's health advocate dedicated to advancing healthcare in Africa, especially in her home in Nigeria. As the founder and CEO of Healthtracker, she's transforming how women access diagnostic services in regions where healthcare infrastructure remains limited. And in a region where cervical cancer is a leading cause of death for women, she's bringing screening to women who have little access to these critical services. Ife recognizes the specific needs of women in her region and across the continent. Through creativity and technology, she provides impactful solutions. So stay tuned to hear about what lemons have to do with sexual health and how an AI bot called Lola can be a woman's new BFF when it comes to menstrual problems. I'm really excited to have you here, Ife. Thank you so much for being here.
The pleasure is mine. Thank you for having me.
And, we just met a few months ago. We were in New York for what I'm calling a UN adjacent conference, and I had the absolute honor and delight of sitting next to you and really felt like I had met a kindred spirit. So
Absolutely.
I really wanted to learn more about what you did and share that with our audience, and really provide just a different perspective than we're usually able to have on the show. So thank you again for being here.
I'm glad that I'm here. Thank you.
Of course. So tell us a little bit about what Healthtracker is and how you came about creating it.
Yes. I always tell the story saying that it was a tragedy that turned into a desire of hoping that it never happens to anyone. And it was that I got the call one of the days that my dad had slumped. And it was weird because before that, he wasn't sick. There was nothing wrong with him, at least so we thought, until the doctor then told us, he's, based on his numbers, he's had hypertension and diabetes untreated for so long. And it had degenerated into a stroke. So I basically watched this super African dad who is lively, energetic, full of energy, become a shadow of himself, right? And basically dependent on everyone around him. He became a literal shadow of himself, and he passed away, right? That was 4 years ago. So that was 3 years ago, actually, November 9th, 2021. And I remember when I got the call that he had passed, apart from the grief, I think the painful part of it was it was avoidable. Hypertension and diabetes is not a killer disease. These are diseases that can be managed, but we didn't know. And I remember that all I kept thinking was, it doesn't make sense. If we had caught it early, he would be alive today, right? Because obviously it's easy to manage. And again, my background is science. I studied biochemistry, but then I pivoted into digital technology and been working in, and driving growth for digital technology companies on the continent for the past 7 years before that. And all I kept thinking was, this was such a big problem in Africa, because my scientist mind and then my background in technology didn't make it make sense, right? Because apparently, the data is saying that there's a rise in non-communicable diseases in Africa, and that, barely 30% of Nigerians were even making it to any healthcare facilities to access any form of diagnosis at all, right? Obviously, there is also lack of infrastructure in terms of healthcare. So it just feels like millions of Africans are literally dropping dead for illnesses that, if we had caught it early, could easily be treated. So there's obviously a problem here.
After going through her own devastating personal loss, Ife couldn't help but connect it with what she'd been seeing professionally. That's what sparked her to start Healthtracker, to make medical testing and diagnostics available to everyone by using digital tools. She also noticed a growing problem in Nigeria. More and more people were adopting Western lifestyles, but the healthcare system just wasn't equipped to handle all the health issues that came with those changes. Her company stepped in to bridge that gap.
So Healthtracker started out as a digital health company that had on our platform, users could order basic health checks and get it delivered to them at home, right? So we were aggregating labs, we were aggregating phlebotomists and sample collectors, and basically mapping them to the closest user order or in terms of lab testing required. So things like full body screenings, you could order on our platform, and you would have the closest phlebotomist or sample collector assigned to you to take your samples, and then we had labs who would analyze the samples. We also created a dashboard where you could view your result after. But not only that, we're also linking to treatment and care. So for every user who gets a result, a lab test done on our platform, you get a complimentary doctor's consultation to review your results. And then, you can then that linkage to treatment happens. So do you need medications? Do you need a repeat test? Do you need vaccination? Do you need to be referred to a specialist? So we handle that mental. But we strongly believe that diagnostics needs to be the beginning, because if you don't know, then you don't even know what you're treating. And so we did that for the first 2 years. We delivered over 50,000 tests at home, tens of thousands of users. And it was then that we discovered women's health because we clearly saw that women were spending more time in poor health than men. Right. And women's health is just being underestimated. For example, less than 8% of Nigerian women have ever been screened for cervical cancer. And it's the leading cause of cancer-related deaths on the continent. So combine that with low vaccination rates in the country, it's like women can't catch a break. And then, PCOS, we just saw that women were struggling with PCOS, uterine fibroids. Breast cancer obviously is the number one cause of death, cancer-related deaths in the country. And it honestly feels like women can't catch a break.
Almost all cervical cancers are caused by human papillomavirus, or HPV, which is sexually transmitted. The infection itself is not painful and may not be evident on the cervix until years after introduction of the virus. So the only way most women find out they have it is through screening.
Last year, we launched HPV self-sampling kits, which is a kit where women can screen for cervical cancer from home. So all we need to do is just mail it to you at home. You can take your own sample, and we can even pick it up from you. So, and those are some of the solutions that we have launched so far. Yeah, it's interesting that when we had the idea that because HPV is it's a DNA test, right? So which means that you just need to take the cervical sample. There has to be a way where you don't need to come all the way to the facility for anyone to take your sample. One of the reasons people, at least in Nigeria, haven't screened, one, of course, affordability. Two is it's just the fear of, what if they find something? Then what happens? Or I'm dead, because it's cancer, right? So it's even the fear of the unknown.
That's pretty universal.
Yeah, it's nerve-wracking, right? If we're being honest. So what we realized that from a psychological point of view, it kind of feels a little bit more empowering if you're taking it yourself. It doesn't feel as horrific because I'm just taking something, right? It's like putting in a tampon, right? So we found just psychologically from a product use and point of view, it gave people a lot more space to just be like, let me try it. Maybe it's not that bad, right? Especially because, we did a pilot in Kaduna. Kaduna is in the northern part of the country. And it's, we did a pilot in the rural part of Kaduna because we wanted to test that for people who are not educated. These were female farmers in the villages who would never have the opportunity to leave their market, to leave their farm, leave their children, leave their husbands, they would just won't, there's no time, they won't do it. Their husbands may not even allow anyone to put anything in their wives because they are Muslims, and it's against their culture and religion in that sense. So we wanted to pilot it, and we realized that they were happy to use it, right? Because now it's like, oh, okay, I just put it in and that's it, right? And we spoke to them in their local dialect. Within 5 minutes, you're done, you're back to what you're doing. So and that was when we knew that, we have to look at women's health in a more culturally sensitive, more contextual approach, so that we're solving in a way that people can actually access healthcare in which that just suits them, or else we're just going to be doing the same thing over and over again and wonder why there's a different reason, wonder why it's not working.
The success of their approach really showed that healthcare solutions need to work with local cultures and logistics, not against them. One simply cannot copy and paste Western models and expect success. What made Healthtracker effective was how they built the complete care journey. For those women who tested positive, they were referred to treatment centers. For those with negative results, they were referred for HPV vaccines. We then shifted to discussing the changing healthcare infrastructure in Nigeria. A combination of limited insurance coverage, urban concentration of healthcare facilities, and healthcare worker shortages has created significant barriers to care for many Nigerians, especially those in rural areas.
The interesting data is that less than 5% of the population has any form of health insurance at all. So which means, people just don't have access to good health care, right? And coupled with the fact that affordability of healthcare is a huge challenge, people just can't afford good healthcare. This is just as simple as that. But what that also means is that most people, again, it's almost like a loop, right? It means that most people do not go in to anywhere until it becomes a real problem. And at that time, the risk is already increased, right? And, and which is why it feels like the mortality rate can be higher. And that's also why, pharmacies are becoming the primary healthcare centers, because at least you can treat, some of the symptoms. So I feel better. I go back to to my work, and then, we live to see another day. If you come to Nigeria today and you go straight to Lagos and Abuja, you would find good healthcare because obviously those are the urban cities. But you just need to take a little bit more, some kilometers away from the centers, and then you can begin to realize the true state of the country, right? And that's generally even in Africa. So the healthcare infrastructure that exists mostly, obviously are dominated by private health sector, right? So which means they have to go where the money is, and then they stay in the urban areas. Whereas, of course, we have the primary healthcare centers by government, we have the secondary, you have the tertiary, which are overrun. And it's, it's basically full to the brim, can't keep up because everybody else is trying to go there because, obviously can't afford that. We also then have, a low doctor to patient ratio, which the last time I checked is getting close to 1 to 8,000. So that's one doctor to 8,000 patients, which has gotten worsened by the fact that most of our doctors are seeking greener pastures, which you can't blame them, and trying to leave the country, obviously. So again, which goes back to why the primary, the pharmacies are becoming the first point of contact, because what else are you going to do?
Right, exactly. Sure.
And then right now we're depending a lot more on healthcare workers, training people, like anyone who can support, who can help, because, we need everybody, right now who can provide basic healthcare services to people.
Building on their initial success, Healthtracker continued expanding into other critical areas of women's health that were being overlooked.
It was last year as well. Again, we began to see a lot more women. In fact, we did, because of my background in go-to-market strategy and all of that, we did some social listening and realized that PCOS is such a big deal for women. It's insane how much, young people are complaining and, just talking about how difficult PCOS has made their lives, right? And we looked around and realized there was no way to even know what you had. Diagnosis was late. In fact, it was people talking about their symptoms like, oh, I have that too. Oh, maybe you have PCOS. Oh, now I have PCOS. I'm like, so I remember that, we went around, starts with gynecologists and endocrinologists, and then created, can we have like a bouquet on-demand PCOS test that we can even know, so that at least first level we can see, is this even a thing that I have? And we created that, launched that last year as well. Beyond that as well, we also noticed that over 60% of new HIV cases are found in young women in sub-Saharan Africa. Again, doesn't make any sense, right? Because we thought we had eradicated HIV, but apparently not. And why young women? So again, looking closely to the data, we realized, of course, the cultural nuances, the stigma around young girls, young women. You're going in to ask, you can't go in and say, oh, I need this, that. It means that everybody knows you've had sex, but you're only 20, you're not married. So there is just no, there is still a lot of that cultural complexities in terms of gender, but so the confidence is not there to walk in, and because of the stigma and all of that. And we began to think about it to say, you know what, we are innovators. What can we do here? And that was when we used the same model for self-sampling, HPV self-sampling, and said, can we have STI self-sampling? And what we did was we called it Lemon. So that way, nobody knows. All you need to do is go into the nearest pharmacy to you and ask for a lemon, right? With that pack, it would screen for HIV, hepatitis B, syphilis, chlamydia, and gonorrhea. So 5 tests in one, and we call it lemon. And we just wanted a way for it to be cute and, just very... and we walked up to the biggest pharmacy chain in the country with over 100 stores. I'm like, what, can we pilot this, roll it out, put banners everywhere and just say, ask for lemon, and all. And we began to see that, people were a bit more confident to say, I just need a lemon, that's it. And then they know what you're talking about. This year, recently, we launched Lola. So, I smile because I really love Lola. So, and he's leveraging AI to drive access to menstrual health products. Lola is meant to be like your best friend on anything menstrual health. And we built it on WhatsApp, right? It's generative AI on WhatsApp. So that way it feels like you're chatting with a friend. So Lola is able to talk back at you, very friendly, very chatty, and she's a girl's girl. We designed her to be a girl's best friend, and be able to say, hey girl, the language, everything to suit in a way that makes you feel like there's somebody listening to me. And obviously also be able to link in case you need to speak to a doctor. We'll be able to provide you some links, and all of that. Again, just a few months, but we already have thousands of women and on it, and they love it as much as we do. So we're hoping that we can scale that to a lot more women as well, because we just realized, what we need to build for women.
Wow, that's terrific. Do you charge for it?
Right now, we don't. We're hoping that when we get to critical mass, we'll be able to figure out the monetization plan for it.
Sure. What language is it in?
Right now, it's in English, but again, because it's generative AI, it can be multiple languages. So those are some of the features that we're rolling out in a few.
So if anyone that's listening, because we do have not only from the U.S., but we do have some international listeners, can women avail themselves of this?
Oh, absolutely. It's a WhatsApp link. If they,
we'll put it in the notes.
Exactly. If you're able to just click on it, it will take you straight to WhatsApp and you begin to chat with Lola.
These innovations recognize the cultural context in which women's health needs exist. By creating discrete, accessible tools that work within existing behavioral patterns, like using WhatsApp, which has over 95% penetration in Africa, Healthtracker removes multiple barriers to care simultaneously. And while technology offers important solutions, Ife recognized that broader systemic change requires advocacy and research as well.
But we realized that a huge part of what needs to be done is not just innovation, right? Because if you don't know, you don't even know that you need this. Because it's like, oh, I wasn't even aware that this was a problem. So we realized we needed to do a lot more advocacy and more awareness and just more literacy about the different topics, right? So during Women's Month, actually, that was in early March, that was when we decided, you know what, let's create a conference. And we called it Banking on Women's Health. So we had it in May. That was May 6th this year. And what we did was we thought, it was time for us to bank on women's health. And I could see clearly how women's health ties to the economic growth of a country, of a nation, right? And the thesis around that was, let's bring all the stakeholders to sit down and talk about this, right? So we created the conference, the first of its kind. It was an amazing event. I remember that, one of the government stakeholders were like, we only focus on the problems that are, talked about enough. We never knew that this was a problem. So now that you're talking about it, maybe we need to start to look into that. I'm like, okay, that's why we're having this, right? And it makes me really proud because the feedback was really good. Even I saw the way women were asking questions that I'm like, oh my God, it's not fair. We have suffered for so long. We have been silent for so long. But it just felt like a platform where you could say anything and everybody agrees, like, yes, that happens to me too, yes. And then the gynecologists are on the panel saying, oh, this is a problem. Like, oh my God, I thought this, and it was such a beautiful event. And I remember one of the gynecologists, was saying that, oh my God, I'm so sorry that happened to you, because one of the attendees had mentioned that, she had constantly been dismissed by a gynecologist, and she was apologizing on behalf of all and like, we're going to go back to our association and talk about this, because this is not right. We should listen to you more. And I get it, because when we think about women's health, especially in Africa, you're thinking maternal health only. You're thinking, oh, you know what? Of course, and I agree, maternal mortality rate in Africa is high, so it should be priority. So it almost feels like the other part of women's health, in terms of hormonal, in terms of viral PCOS, anything other than that isn't really prioritized. So when you're coming in with something like menstrual, like come on, PCOS, these are not priorities, so they don't get the same attention. And it feels like it was the first time we were actually saying, this is affecting us. We can't work. We can't do anything. The quality of our life, it means we're not making more money. We're missing work. We're not getting promoted at work. So this is real.
Ife took a three-pronged approach of technology innovation, advocacy, and research, addressing different aspects of the women's health gap in Africa. By leading research on conditions that disproportionately affect African women, her organization aims to create evidence-based solutions tailored to local needs rather than relying solely on research priorities set elsewhere.
I knew that, we need to create a nonprofit that is focused on advocacy. So we called it FAIR, which is Foundation for Advocacy, Innovation and Research. We have to be leading our own research. We cannot wait for the West to research on the problems that affect us. Uterine fibroids, for example, may never be the priority of the West because they just don't have as much. It's Black women that have to deal with this, right? And our diet is different. We have researchers in different universities. How can we help them accelerate some of the research to get commercialization on time? Can we get regulators on ground? Can we create a center? I want a center where it would be a hub for all the research that is happening on women's health on the continent, and we can have access to it. So, I'm always an advocate of looking at Africa differently. I think even at the New York event, one of the events where I spoke, I mentioned this. That the same way that the United States is not defined by the homelessness or the gun violence, at least not alone, and is still defined as the world's power and, the land of the free and land of the opportunity, I would really advocate for people to begin to see Africa as the next frontier, and not just see it as the poverty capital of the world, but see that's not what we're defined by. There is a whole lot of innovation. There's a lot of industrialization that is happening on the continent. That I'm usually just an advocate of. People need to look closer and see the gold in Africa.
Ifeoluwa Dare-Johnson, thank you so much for being with us today and for shining a light on what you're doing and the continent as well.
No, the pleasure is all mine. I had a great time. Thank you.
By combining technology with cultural understanding and advocacy, Healthtracker is transforming women's health outcomes across Nigeria and potentially beyond. In fact, these approaches offer valuable lessons for healthcare delivery in underserved communities worldwide. Thank you again to Ifeoluwa Dare-Johnson, founder of Healthtracker, and thank you for being with us today. I invite you to visit our website at beyondthepapergown.com and sign up for our newsletters so you can be up to date on our podcast, news articles, news events, and more. And while you're here, please subscribe to Beyond the Paper Gown and take another moment to rate us to let us know how we're doing. And until next time, take good care. Our podcast was produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.